we think about high conflict, we're looking at enduring patterns of very intense arguments that never get resolved. So it's just ongoing. Sometimes I have family members in multiple states and we're doing sessions virtually because that's the best we can do.
Hi everyone, Christopher Bruce here. Today I'm going to be interviewing Dr. Stefanie Mazer. She's a licensed psychologist in Wellington. She works a lot with men and women, both in the Wellington community through her practice, which is in person and also virtual through 42 states. And today, what we're going to be talking about is navigating a high conflict divorce with children. This is going to be a great episode, informative, both in strategies for how a parent can successfully get through a high conflict divorce and the special considerations that they should have when it comes to helping their children best get through the end of not just a high conflict relationship, but also navigating conflict in general. So it's going to be a great episode. I hope you find value in this. Let's get into it now. So Stephanie, can you explain in simple terms what is a high conflict divorce and how can it affect children and their parents?
I think when we think about high conflict, we're looking at enduring patterns of very intense arguments that never get resolved. So it's just ongoing.
And how does that end up, being a challenge for kids?
Well, when kids are exposed to this type of conflict, it impacts them physically and psychologically. So their nervous systems are literally getting hijacked. So when you have parents who are in these pervasive patterns of high intensity conflict that doesn't get resolved, the parents are oftentimes unregulated. They don't have the resources to regulate themselves. And what children really need is two things. They need to be protected from this type of conflict so that their nervous systems aren't getting hijacked. And they need parents who can help them co-regulate. So if they are exposed to some sort of a nervous system dysregulation or activation, that they have someone there that can help them come back to baseline.
And you're talking about the nervous system here, and I want to make sure I understand it and our listeners
Mhm.
do too. I've been on this health journey, so to speak, over the last year. Thankfully, I've got a partner in crime of my wife doing it with me, and through the process of changing diet, exercise, all that stuff, I've been now consuming all of this, health literature and content. And one of the things I've been learning about is when the body is under stress, it
Mhm.
produces cortisol,
Yes.
and it's almost like internally it's a constant state of
Mhm.
inflammation inside of us that, as we're on the older side of the age range, is the stuff that leads to these chronic diseases that, are
Mhm.
really affecting, a lot of our aging population. Is that the same stuff when you're talking
Yeah.
about nervous
Yeah.
system in
Mhm.
kids?
You can actually do saliva tests and measure cortisol levels in children exposed to stress, and it impacts them physically and psychologically, being exposed to stress.
So this is just not a emotional process. It can be a physical process, which
Like,
is heightens the importance of trying to do this stuff. From what you see in your practice and your clients, what are some of the most common ways children are affected by their parents going through one of these higher conflict divorces?
So, when parents are stressed and going through these really emotionally charged processes, there's a couple things that can happen. First of all, children can be exposed to the stress itself and the conflict. Oftentimes, stress and conflict in relationships can get diffused by triangulating a third party in. So, that third party could end up being the child. So, now the child is literally the absorber of that relationship stress. There's different ways that can impact a child. They might feel like they have to be loyal to one parent over the other parent, which leads to a host of other issues for the child. So the physiology and then the psychological dynamics that play out.
You and I both work with men and women, but I think we both work a lot with females that might either be, contemplating or going through what I think you and I were talking about as like a end of the bell curve, harder, more messy, maybe high conflict divorce. And I think
Mhm.
what a lot of the people who end up being my clients or thinking about the process end up asking me is, hey, like, how is this going to affect my kids? Even if I'm trying my best, and maybe even my husband tries his best to shield them from what might still be conflict between us.
Well, support is really important. Kids are very perceptive. So even if you're trying to sort of hide it or mask it, kids can pick up on things. So really doing the work as you're going through the process. And so what does that look like? Being able to have the skills to emotionally regulate, being able to practice reflecting instead of reacting, learning mindfulness skills and grounding techniques. This might be one of the most challenging things a parent can go through. And you kind of have to be ready for war, ready to climb that huge mountain. And so it's hard work and, it takes diligence every day doing the work. And there are resources out there and there's help out there. But so parents don't need to do this alone.
And I think I want to key in on what you just said. You're talking about work for the parents to be doing,
Hmm.
to really, I guess, set up the foundation to best allow the children to emerge with their parents from one of these difficult divorces. Am I hearing you right?
Yeah, absolutely. We don't want to put the burden on kids. And so kids need safety, security, consistency, structure, and that's possible if the parents make that a goal. And if they can't make it a collaborative goal, to make it an independent goal. Okay, in my home, I can control this. And committing to a plan based on values, not just sort of winging it.
Stephanie, we're going to get into a little bit later, I guess, some of the work that the parents should be doing to, I guess, best set the foundation for
Mhm.
successfully, personally getting through a hard divorce, and allowing their kids to. But for a moment, maybe we can talk about how this divorce process can affect the kids and, maybe long term affect the kids. And a question I get a lot on that is, related to the age of the children, and just from what you've seen and what you've experienced with your clients and their children. I mean, do you see any trends on how children at different ages react to the divorce of their parents, especially a harder one?
Yeah, sure. So younger children, you might see regression. You might see bedwetting, behaviors that, they've grown out of are coming back into play. That you might witness with younger kids. For school age children, you might see them taking sides,
Yeah.
scared that they're going to lose both parents. So they want to cling to one. For teenagers, you might see more acting out and externalizing and anger, or you might see them becoming withdrawn and depressed. Physical symptoms can be for any age child where, they're manifesting physical symptoms of anxiety and internalizing things that really aren't appropriate for kids to be internalizing. It's their parents' stuff that their parents
Yeah.
should be handling. So, stomach aches, headaches, physical symptoms like that. So, every child is unique and different, but you do see some age related behaviors depending on the child and their age.
And I mean, this may be a question without, an answer that doesn't just depend on the particular children or child at issue. But, one of the things I see, or I feel, the people that interview attorneys at my firm process is there a best time to get divorced for their children? And I see every concerns at each end of the spectrum, from, my husband isn't safe to take care of like a young child,
Mhm.
to, my teenage daughter, how's she going to react and act out, all the way up to how can I do this now? My kids are having kids. I'm going over there as the grandmother, and I taking, hundreds of client interviews and putting them into,
Sure.
I guess, a question here. But like, is there a best time for kids for their parents to go through on unwinding one of these harder, more toxic relationships? I think a lot of people wonder about that.
So I think that I don't think there's a best time necessarily. I
Yeah.
think that when the conflict is chronic, it's time to make a change for the best interest of the child. We do know that living with conflict is one of the predictors of maladjustment, whether a family stays intact or whether they get divorced. So that's going to have a huge impact on a child in the immediate, the short term, and the long term. So providing relief from that conflict would be the only timing that I would be aware of.
And this conflict and its effect on children, parents also, in like a really dysregulation of your nervous system at the end of the day,
Yeah.
living in inflammation inside of you. How is that happening with kids and parents in one of these, maybe more abusive relationships that remain intact? Like what is a parent staying in one of these difficult relationships affect their kids if it does? I think a lot of people think about, well, like divorce, it's going to cause so much effect, but they don't necessarily always think about what's going on with their kids based on the situation in the home and relationship right now.
Yeah. So the research does indicate that children who go through divorce and there isn't a lot of conflict and parents are able to cooperate and co-parent fare better than children who come from intact families where conflict is chronic and very high.
Is it, I guess, accurate to say then, kind of based on that, if parents can ultimately co-parent after a divorce, their children are probably going to be, based on these, I guess, the studies, statistically better off than if the relationships stayed together?
Well, so I don't want to advocate for divorce
Yeah,
necessarily.
absolutely.
Um, so I would advocate for parents who are married and experiencing high conflict to get the support that they need to
Mhm.
disrupt that cycle and pattern because stress affects children, chaos affects children, high conflict, high intensity affects children negatively. We know that. If parents do decide they want to get divorced,
Yeah.
the best thing they can do for their children is to find a way to be both adversaries and collaborators and look at the relationship in more of a business sense. How do we work together for these common goals for our children that we share? Coming up with a plan. And that's not always possible. When there
Mhm.
is abuse, you have one parent that is not able to participate in a co parenting relationship. There are other options. Parallel parenting is an option, and that really gets spelled out through a parenting plan. So clients need to be educated about that when they're approaching divorce and approaching what this is going to look like, because once a parenting plan goes into place, that's in place pretty much until the child turns 18 unless there's extraordinary circumstances.
Yeah.
So I don't know the legal terms for what those extraordinary circumstances are, but once you sign those papers, that's the framework that you're working in. So being aware and knowledgeable about how do you parallel parent when co-parenting isn't possible, but ultimately the goal would be co-parenting.
I think with what both of you and I focus on professionally, our fun is not made by talking about problems. We like to fix things, make things better for our clients. So maybe we can focus on that a little bit. If you have somebody coming to you and you get an indication that maybe there's conflict in the relationship and they want to try to tone that down, maybe just to make the relationship better, because wouldn't that be nice? Where should they start? Where should somebody, even if they're thinking they need to get divorced and it might be a hard one, what are the things you think they should be working on to best set them up to maybe have a better relationship, be healthier, and if they do go through a divorce process, if that is what ends up being appropriate, that they can have the best tools
Mhm.
to set them up for that.
So I like to start with the nervous system because unless we are aware of our physiology is really driving us. So when we're in fight or flight mode, that's going to impact our decision making, our thoughts, our feelings. So I like to help clients with nervous system work. For this type of work, also DBT, dialectical behavior therapy. So we work on distress tolerance, emotional regulation, effective communication, how to hold two opposites. Like, how do you be an adversary and a collaborator? What does that look like? What does that mean? And a lot of psychoeducation.
So I think what I'm gathering is from what you're saying is there are practical techniques that people
Absolutely.
can learn,
Mhm.
just allow them to be, for lack of a better term, you could probably put it better, but calmer and not as stressed maybe.
Not
In
as reactive.
Okay, not as reactive. That
Hmm.
makes a lot of sense. And, by seeing somebody like yourself, they can kind of learn, you have the PhD, which means you have the ability to talk probably at every level of psychology that anybody ever wants to. But some of this stuff's pretty practical, isn't it? It's not
Very, yeah.
it's not some people think seeing a psychologist, this is going to be, how am I going to even understand what they're saying? That's a very narrow, poor view of where somebody with your expertise can come in. But we're just sometimes talking about basic life skill trainings to deregulate a person, right?
Yeah, yeah, to help people regulate. And it's so important so that they can help their children regulate. Children don't have that ability. They need parents and safe people to help them co-regulate when they become dysregulated.
Maybe this is a silly question, but how does a parent, or why is it necessary for a parent to be able to regulate themselves in order to allow a child to learn or be able to do the same thing?
So emotions can be contagious. They're very contagious. Nervous systems can be contagious. So if a parent is able to stay grounded, regulate their breathing, their blood pressure, their heart rate, it's going to have a mirroring effect on the child. Likewise, if a parent becomes dysregulated, that too will have a mirroring effect on the child.
I think you're hitting on something that is just like I've had to try to learn it the best I can as a parent. I conflict divorce lawyer when I put my suit on and go out into the world, and it's I've had to learn with my kids who are younger that usually when they're acting out and doing something that my wife and I are upset about, if I really can step back and look in the mirror, they're just doing what we're doing.
Mhm.
And I'll tell you that was I read it in a book, and my kids were younger, but I think there's no time to learn like the present. That was a very humbling thing to realize, and it caused me to have to be much more self-aware of myself, because I mean the kids feed off this stuff. Whether you have a great relationship, and even if divorce is never hopefully in the picture for some people that hear this, I think it's a tremendous takeaway from what you're saying. I mean, your kids feed off of you, and the what a life skill to be able to teach any young person, or old person at any time, to then to be able to regulate themselves and really be in a healthy state of life, really.
Yeah, and kids might not be aware that you're co-regulating by bringing your energy down and helping to soothe them in the moment. But now they have that ability to come back to grounded state, to become regulated. And so things don't feel so out of control that when their nervous system gets activated, they don't know how long it's going to take, or they know that they can come back to baseline, and that can be reassuring.
So I guess it's as back to the discussion at hand with parents and who might be leaving a harder relationship and with kids. Any other things you'd wish that they would start learning about or becoming educated about, including how their behaviors or things they might say or their spouse might say might have an impact on their kids?
Yeah. So things that you want to avoid is you want to avoid burdening kids with things that they can't control. Like, for instance, money. Let's say that there's arguments about money, arguments about child support. You don't want to burden kids with that. Kids can't solve that problem. They should not be involved in any conversations about finances, especially if it's coming from a parent who is feeling like they don't have enough money or they don't have enough financial support. There's nothing a child can do to fix that problem. So that's just stress that the child will carry. That's just one example of an adult burden. You don't want to
Yeah.
burden kids with adult topics that they can't do anything about. They have no agency. Something else is you don't want to blame. You don't want to blame the other parent. The child internalizes both parents. So if you're talking bad about one of the parents or you're blaming one of the parents, the child feels like you're blaming them because they're a
That makes
part of that parent. And again, they can't solve that. They don't have agency. That can lead to feelings of guilt or feeling like they're bad or shame. So blaming, burdening, and baiting. You don't want to bait kids for information about the other parent or bait them into conversations about the other parent. So all of these are around boundaries. Okay, so the anecdote to these negative B's is the positive B, boundaries. So how do you set up healthy boundaries in
Yeah.
your own home? So you can't control what's going to go on in your ex-spouse's home, but you can control, what's going on in your own home, what kind of conversations you're going to participate in. And listen, your child might be experiencing this in the other home where they're getting baited or burdened or blamed and they want to bring up the other parent. So it's up to the parent that's going to have very well-defined values and goals about what the parenting is going to look like in their own home and not participate or engage in conversations about the other parent unless they're positive or
Yeah.
neutral or healthy.
And I kind of like, well, all of this stuff makes complete sense. And I mean, I'll say what Dr. Mazer is saying, the do's and don'ts. She very well may know it, but it's pretty much tracking what parts of the child custody statutes say when judges have to in Florida and a lot of other states kind of have similar laws, determine what's in the best interest of kids. They look at these things. How much do parents involve the child in litigation? What is a parent? The number one factor in the custody statute, some call it a super factor, is a parent's capacity and disposition to facilitate a child's relationship with the other parent, and doing things to where this baiting and these lack of boundaries, bringing children into issues that really should be issues between parents, is all of the stuff that, from what I'm hearing from, the mental health field, are things to do and not do. But on the legal side of it, it's how these judges make decisions pretty much follows the same dichotomy. So this is all really good stuff that people should pay attention to. And if somebody's listening to this and they're thinking about what we're talking about and they're looking, some people I find, if they're told, okay, here are all the things not to do, and they take it to heart, they try not to do it, but they think, what are some proactive things I can do every day to make it better for my kids, as they're going through maybe conflict in a relationship or just life in general. And obviously being able to regulate as a parent, filters down, and that's a proactive thing. But anything else that comes to mind, that, like, if a parent was to say, hey, I'm going to do one or two things, or try to do one or two things every day to best help my kids, like, what would those things be?
Well, first, I just want to validate what parents are going through. So, if they're
Yeah.
going through a high conflict process with an ex, this is a painful process. So it's not easy. And so every day it's going to be about getting support and doing the work, which isn't easy. That's not easy. So parents, again, being diligent about getting that support and doing the work. There's no handbook in our society about how to get divorced and how to raise kids or even how to get married. People come in with all different types of ideas based on their own experiences, their own family experiences, social and political constructs that are influencing different communities. So there's no rule book. And so getting as much information as you can get, sitting down and really defining what are your values, what do you want for your children, and looking at the long game, because you are informing your child's blueprint now, that they're going to take into their own relationships and their own reflections in the mirror and their own feelings about themselves, in the immediate and as they grow up and as they become adults. So giving yourself grace. and finding people to validate what a challenging and painful experience this can be.
I think that's really great advice because some people think, I need to be doing this, I need to be doing that, and maybe what they need to be doing sometimes is just taking a deep breath
Mm.
and realizing what they're going through, and
Yeah.
giving themselves grace on what they're experiencing, and yeah, try to do their best and
Hmm.
take to heart some of the things you're saying, maybe get some help for that so they learn what is the work to do most effectively. But I think that's outstanding advice. Sometimes the best thing to do is just realize what you're going through
Yeah.
is hard. It's not always going to be perfect. It's not going to be forever, either. And when it comes to professional help, how can a really good therapist or psychologist end up benefiting a child whose parents are going through a high conflict divorce? And I guess it's not just the parents going through a high conflict divorce, it's a child that's going through one too.
We want to do the best we can to protect the children. So, looking at protective factors, what are some protective factors? Parents having the ability to take care of their own needs and themselves. Parents defining how they want to parent and finding the resources. There's a lot of parenting approaches out there. My favorite one is love and logic. It balances logic and empathy. To be honest with you, I haven't looked into that, but I do recommend it to clients. I haven't read the literature in a very long time,
Yeah.
but there are parenting programs out there, and there are professionals that you can work with, parenting coaches, psychologists, therapists. If you get into challenging times, there are parenting coordinators that can help navigate difficulties if you're sort of in that in between of co-parenting and parallel parenting. So finding the resources, because again, this isn't something that we learn in school when we're growing up. We don't major in how to parent, how to marry, how to divorce. So
There was
education.
a class on that, it would probably encompass two doctorate programs. It would have no answers because there's a lot involved, or at least from my perspective. When it comes to just what you see in terms of tools available in the mental health field, if there's a parent that, they recognize a hypothetical parent, she recognizes that, maybe after being in therapy for a while, and really thinking about things, which is always what I advocate with people. Don't be reactive. Divorce is a big thing. You should really make sure it's the right solution, for your situation. But if somebody does realize that, divorce is inevitable, they have children, they think there's a good chance it might be a harder divorce. Do you have any prescription, so to speak, for that person in terms of should they be seeing a certain type of professional? Should they have their children potentially seeing anybody? Should there be try to be? I hear family therapy thrown around a lot. I mean, do you have any general advice on that? I know it's really person specific, but
Yeah, I think there's different approaches. So spouses can go through co-parenting therapy or co-parenting coaching, and work with someone on what does that look like? What is that sort of business relationship, balancing being adversaries and collaborators? What does that look like? How do you do that? Individual therapy, therapy for kids, so that kids can have a voice and can name what they're going through and share their feelings in a safe space. So there are different supports out there.
all right. And just like I feel in asking this question, like I feel like I know an answer, but I think it would be the answer would be, now or yesterday. But is there I guess the question is there a sign or a right time for a parent to go and get professional help for a child when they have a relationship with a great deal of conflict in it, one that might be headed for divorce?
So I believe very much in prevention. So stacking up your protective factors. So reaching out for help so that you don't need to intervene when the problems are bigger than maybe they would have been if you hadn't taken those protective steps and preventative steps.
I guess in talking about some different tools, you were talking about, co-parenting and coordinating. I mean, how have you seen that help in a process where there's a divorce with kids?
So co-parenting would be the ideal, right? Where parents can collaborate on what co-parenting looks like and what how that is experienced by their child, handoffs, schedules, exceptions to schedules. So really being able to collaborate, that would be the ideal. When there is abuse or the situation is dangerous, there's something called parallel parenting.
Yes.
Are you familiar with that?
Yeah, and maybe I think that'd be a great thing for you to explain, because sometimes the reality is parallel parenting is what somebody's gonna be dealing with. These other interventions are not gonna be productive when the other person, I'll just say, is a certain way.
Yeah. Yeah. So trying to shield the child from hostile interactions, if that's inevitable, if we know that it's just not possible, a variety of reasons. You could have somebody who has a very severe mental illness, somebody with a severe drug addiction, where it's really dangerous. And we don't want to unnecessarily implement a parallel parenting plan. We don't want to weaponize that if two people are healthy enough to be able to do the work, to do the co
Yeah.
parenting. So that's really only used in special situations to protect the safety of the ex-spouse, to protect the safety of the child, and to limit the exposure of the child to, again, the conflict, because being exposed to stress and conflict is, we know, has negative consequences for the child. So parallel parenting, parents need to be aware of that before they enter a parenting plan. So that's something that they can discuss with a mental health professional, so that when they meet with an attorney like yourself, they can help inform the attorney of why why their safety is at risk. But maybe they already do that. So
Sometimes they do, and I mean, parallel parenting, I mean, is I generally interpret it as a situation to where you're just not gonna be able to have the other parent co-parent with you. You're gonna really, the other parent is going to do whatever they're going to do, and it's not going to be, nobody's on the same page, and it's going to be hard to get the other person there, and whether that's due to addictions and things that maybe one day don't exist, or to maybe a diagnosable mental health disorder. It's the word terms get thrown around a lot, narcissist, sociopath, things of that nature. But the fact is, you could probably tell people better than me. There are certain people that act differently than, others, and sometimes behave in an irrational way. Maybe, I've talked with clients. We talk about, are these people, maybe half joking, are they straight from hell, or is it a mental disorder? I know professionally it's a form of a mental disorder, just that's they're never going to be able to co-parent for one reason or another, and you have to realize that and try to come up with a legal process with a parenting plan that takes that into account. And in my experience, at least, that's of course never the desired situation, but I feel strongly that when you have a lot of high chronic conflict in a
yeah.
household, in my view, usually the kids are going to be better off over time if that chronic conflict is over or decreased, even if that means one of their parents has to do this parallel parenting. I don't know your thoughts on that, but that's my observation through some of this.
Yeah, I think whatever we can do to protect the child from that chronic stress and high intensity conflict. And parallel parenting isn't restricting parenting rights, it's just decreasing exposure of the ex spouses to one another. And you can't change somebody, right? You can't
Yeah.
change. All you can do is control what's going on in your own home. So with that parallel parenting, if you are the healthier parent, it's your responsibility to not be talking badly about the other parent, to not be burdening the kids with any conversations that are about the other parent. So the parallel parenting, also needs to cross over into the home, where you're really talking about the other parent in a very neutral way and respecting that relationship,
So,
that parent-child relationship.
Dr. Stephanie, let's talk about you for a minute. Where does your psychology practice fit into all of this? What are the ways that you help people in your practice?
So I specialize in anxiety and relationships. So I work with a lot of couples. I also work with individuals who are going through divorce or after divorce.
And as I know from talking with you, you work with people both on a trying to fix the relationship, trying to make a relationship a better one, maybe one that doesn't need to end in divorce, but also helping them process is divorce the right thing, and if they are going through it, what are the ways they can best do it for themselves. Am I missing anything here?
Nope, I think you got it.
You're out in Wellington, you're very close to one of our offices. But are you strictly in person? Do you do the virtual consultations? How does that work in your practice?
So I prefer in person. I don't feel like you can replicate the same type of space and session virtually. So I prefer in person, but I am licensed to practice in 42 states and I do offer virtual telehealth. Sometimes I have family members in multiple states and we're doing sessions virtually because that's the best we can do.
No, that makes sense, and I think that's important for the people, especially kind of the equestrian crowd that's out here in Wellington. Some of them are here for a season, and then they go away to cooler
Yeah.
places in the
Yeah.
summertime. And we'll have it in the show notes, but I think it's worth just saying if somebody's hearing this and what you're saying is resonating with them, they'd like to talk with you about maybe having you help them with some of these issues. What's the best way for them to get in touch with you?
They can call me 561-414-2144. They can look me up online. I have a website, drstephaniemazer.com. They can send me an email.
Pretty simple. And as we're getting ready to close out here, if you had one piece of encouragement that you'd like to share with a parent listening right now who worries about their child's well-being in a divorce, what would that piece of encouragement be? Or what is that piece of encouragement?
So the research does say that if we do have one parent that can provide consistency, structure, warmth, security, it goes a very, very long way. So
I think that's awesome advice. Well, Stephanie, thank you so much for taking the time from your life, from your psychology practice to speak with me today. I think this can be very helpful for a lot of people. Really appreciate your time here.
thank you for having me.